Welcome back to this next video in which we are discussing the auditory system. Okay, so in the previous video we discussed the auricle, also called the pinna, which is the external portion of the ear that is actually visible on the side of someone's head. We're going to continue our journey, or continue the story, and this will involve looking at more inner portions of the ear. So we need to see the external auditory canal, we need to see the tympanic membrane, we need to see the middle ear cavity, and we need to see the inner ear, also known as the labyrinth. Now, this involves us going inside of a certain bone of the skull, and that's where we need to actually begin our study. We need to start by looking at this bone of the skull, and this bone is known as the temporal bone. So what we're now going to do is study this bone then. So here is the title, Temporal Bone, and I'm sorry about this sort of little bit of a smudge here, but that's an R and that's an A there, the temporal bone. So I'm going to draw you some pictures of the temporal bone from different angles, so that we can get a feel for it, because all of the structures that we're going to discuss next are going to be inside of the temporal bone. So to begin with, the first angle that I'm going to draw a picture from is going to be from the lateral side, and we're going to be having a look at the left hand side. So the temporal bone is one of the bones of the skull. We're going to be having a look at the left hand side one, so we're going to be looking at the side of someone's head on the left hand side. Okay, so here it comes the picture then of the temporal bone. So anteriorly you have this sort of and superiorly you have this squamous portion here. I'll just continue on like so. So this is a flat portion making up a portion of the side of the skull. Okay, so this is the anterior, this is posterior. We're looking at the lateral left hand side here. Okay, then it will extend backwards like this, and at the back here you'll have a process known as the mastoid process, which I'll put in here, like so. And to orient you even further, this is going to be the external auditory meatus. So the external auditory meatus is a that's the opening of the external auditory canal, which is going to be going into the temporal bone. So of course it needs to go into the head, and this is the actual opening through the side of the skull here. Okay, so I'll just label this up. So this is the external auditory or acoustic meatus that we've discussed previously, but now we're seeing it in the side of the temporal bone. Okay, put some more labels on here. This process back here is the mastoid process, and you can feel this on yourself. If you go to just behind your ear, you can feel a solid bony lump, and that's, you know, it's at the sort of same level as the earlobes. If you follow your earlobe backwards and feel that skin there, you'll feel a solid lump underneath, and that is your mastoid process of the temporal bone. So this is what's known as the mastoid process here, and I'll colour the mastoid process, I think, in orange. And this is all one bone, the temporal bone here. So the skull is not just one bone. It's probably something I should have said at the start. It's made up of lots of little bones, and on both sides, both the left and right hand side, you have a temporal bone, and there'll be mirror images of one another making up part of the skull. Okay, to put some more structures on here, a very important structure is that you have the zygomatic process coming off here, and this is a process that comes off, and there'll be a gap in between the squamous portion, which I'll label up here. So this is what's called the squamous portion of the temporal bone. So there'll be a space between the squamous portion and this process here. So it's attached here and it comes off laterally. So this is in front of this. And if I wanted to, I could get my finger and put it in a gap between this process here and the squamous portion behind. So this is what's known as the zygomatic process of the temporal bone, and you can feel this on yourself as well. This is going to join with a process from the actual zygomatic bone to form the zygomatic arch in the side of the skull. So this is the zygomatic process of the temporal bone. And then here there is a fossa, a sort of space in the side of the bone. This isn't a hole in the way that the external auditory meatus, but it's an indentation here. I've maybe shown it in the wrong way. It now looks like a hole. It's just supposed to be a sort of indentation in the bone, a nice space, and this is where the mandible is going to articulate with the temporal bone. This is where the temporomandibular joint is going to be, and this is what's known as the mandibular fossa here. So in red there, that's not a hole, it's just sort of like an indentation in the bone where the condyle of the mandible is going to sit. So this is the mandibular fossa on both sides. So again, we're looking at the left hand side here. Just to reorient you and make sure that you are oriented, this is the anterior portion, posterior, we are looking at the left lateral side here. Okay, so I think we've got all that we can get out of this picture. So just to absolutely nail this point home, the squamous portion is very, very flat. Squamous means flat, so it's a very thin portion of bone that makes up part of the wall, the lateral wall of the skull. Okay, so if I had a little drill here, I could drill through this very, very quickly. It's not a very thick portion of bone. Whereas the mastoid process, that's a much thicker portion of bone, as you can feel on yourself. Okay, one more thing to add on here is the styloid process, which is a little sort of spike of bone coming down here, like so. So this is the styloid process, and several muscles attach onto the styloid process, and indeed muscles attach onto the mastoid process as well of the temporal bone. Okay, so there is the styloid process. Now, what I want to do is draw another picture of the temporal bone from a different angle. You see, what is my actual purpose in studying the temporal bone? We are doing the auditory system. Well, of course, I'm interested in this hole here. I'm interested in where does that hole go? Well, the external auditory meatus leads into a canal, a tunnel effectively, which is known as the external auditory canal. So just cross out the word meatus and put canal instead. Meatus is the opening. It will lead into the external auditory canal, and this canal is going to run in the petrous portion of the temporal bone, which from this angle we can't actually see. So what I'm now going to do is draw the same bone from a different angle. So what I'm going to do is, instead of looking from the lateral side, I'm going to be a little man inside the brain over here, a little headless man because I've run out of space for him, but he's going to be inside the brain over here, and he's going to be looking back at the medial aspect of the temporal bone. So that's what I'm now going to draw, from the same bone from a different angle. Okay, so this time the mastoid process is going to be over here at the back, and here is the squamous process going around like so. Okay, so I hope this is clear that all I've done is flip this around 180 degrees, and the important thing that I really want to show you now is that there is a portion of the temporal bone called the petrous portion of the temporal bone, which comes off like so, forwards and inwards. So this is a great sort of spike of bone coming off in a perpendicular plane to the plane of this squamous portion of the bone here. So this is what's known as the petrous portion of the temporal bone, and this is where the external auditory canal is going to run. So it will be running in from here. So this is where the external auditory meatus would be, and then there's this canal running inside the petrous portion of the temporal bone like so. Okay, and we will take another picture in a moment where we have taken the cross section through this. A few more things that I want to show on this picture is I want to show the internal acoustic meatus, which is an opening of the petrous, an opening into the petrous portion of the temporal bone from the inside of the skull, and this is actually where the vestibulocochlear nerve is going to enter the petrous portion of the temporal bone. So I'll draw this here. So there is an opening on the petrous portion of the temporal bone known as the internal auditory or acoustic meatus, and as they say, this is going to have important nerves running through it, as we'll see later. So this is the internal auditory, or you could call it acoustic meatus. So remember, meatus just means opening. Okay, another important little opening can't be seen on the picture that I've drawn here because again it's at the wrong angle. What we would need to do is reposition ourselves to be looking at the petrous portion of the temporal bone from the front now. So I'd need to go and stand over here. So if I just draw that, so here is the petrous portion of the temporal bone from the front. There is a little opening down here which I just want to emphasize. This is where the eustachian tube is going to come out. And we'll talk about the eustachian tube later on. It's a connection between the pharynx and the middle ear cavity, and it's involved in equalizing pressure in the external auditory canal and the middle ear cavity. But we'll talk about that later on. But for now, I just want to point out that there is an opening on the anterior aspect of the petrous bone. This is going to be where the eustachian tube is going to come out. And that'll be on the base of the skull. So I want to draw one final picture showing the temporal bone, and I want to show it in the context of the entire skull. So the next picture that I'm going to draw is a transverse section where I have chopped off the top portion of the skull and I'm looking into the cavities of the skull from above. So I'll just draw a very basic picture then. So here we are. It's meant to be an oval, but never mind. We are looking from above. This is anterior, this is posterior, this is left, this is right. Okay, so what you'll have then will look like this. Maybe a little bit further back, but never mind. It'll get the message across. So here is the sala tertiaca where the pituitary gland will be sitting. And then we'll have the petrous portion of the temporal bone in this sort of position here. So this is showing where the petrous portion of the temporal bone sits in, and then we've got the foramen magnum at the back. So this is a transverse section where we have opened up the skull and we are looking down inside, and we can see the petrous portion of the temporal bone. So the squamous portion of the temporal bone would be here. This is the petrous portion of the temporal bone. So here are the two temporal bones coloured in roughly in red there. I'll just put a little bit more going back like that. So this is where the temporal bones actually fit into the skull. So the internal acoustic meatuses, these will be at these sort of positions here. The external acoustic meatuses, they will be in these positions here. And where would the eustachian tube be? Well, it wouldn't open into the inside of the skull. Instead, it opens onto the underside of the skull, so that the eustachian tube can go to the pharynx, because you don't want the eustachian tube coming out and then going into part of the brain. You need it to be going out down into the pharynx, so it will be underneath this floor here. Okay, right. Just to put a few more labels on here, this is the anterior cranial fossa, this is the middle cranial fossa here, going through the sala tertiaca to both sides, so you wouldn't say you have two middle cranial fossae, there's just one middle cranial fossa, and then this is the posterior cranial fossa. Okay, so the petrous portions of the temporal bone, they demarcate the posterior boundary of the middle cranial fossa. Right, so what I now want to do then is show you what is actually inside the petrous portion of the temporal bone. So we are now going to effectively take a section through the petrous portion of the temporal bone. We're going to chop through like so. So you can imagine putting the tip of your carving knife here, putting the base of the carving knife here, chopping through there, and we're going to expose the things that are inside here, because these are the things that we need to study. The external auditory canal, the middle ear chamber, and the labyrinth, the inner ear, they are all inside the petrous portion of the temporal bone. So everything that we need to study from now on is inside there. So that's why I've talked about this bone so much, because everything is going to be inside there. Okay, so I'm going to now inconveniently switch from using the left side to using the right side, just because it's the more classical way to show it on the right hand side rather than the left hand side. So we're going to switch round to the right hand side now. So here we go. So we're inside the right temporal bone petrous portion. So here, this is the external auditory canal. And this will be the external auditory meatus here. So all of this is the external auditory canal. We're coming into the petrous portion of the temporal bone. So this is the petrous portion of the temporal bone, all of this here. In fact, I'll colour it in yellow, a more typical colour for bone to be. Okay, then what happens is the external auditory canal is going to end with a membrane whose name I hope you know because it's a very famous membrane, and this is of course the temporal bone. Sorry, not the temporal bone, the tympanic membrane. And I've actually drawn the tympanic membrane on the wrong angle. Let me just correct that. It's more on an angle like this. The superior portion is more lateral than the inferior portion. Okay, so this is the tympanic membrane here. Okay, and the tympanic membrane marks the end of the external auditory canal and the beginning of the middle ear cavity. So here now, this is the middle ear cavity, and we're going to not really discuss the middle ear cavity in that much detail at the moment. We'll come back to the middle ear cavity, so we'll talk about things like the ossicles later on. The first thing that I want to go to is the inner ear rather than the middle ear. What I will just show quickly on here is the eustachian tube. So the middle ear has a tube connecting it to the back of the pharynx, which is known as the eustachian tube. So this here, this is the eustachian tube, also known as the pharyngotympanic tube, or indeed you can call it the auditory tube. So I'll write some of those other names on here. So you can also call this the tympanic, all one word, pharyngotympanic tube, which is nice because it describes exactly where it's going between. It's going between the pharynx and then the middle ear cavity, which is close to the tympanic membrane. And I'm going to do something about the tympanic membrane because it looks awful in this picture. I'll colour it in blue and hopefully that'll fix things. Okay, it's a bit thick now, but never mind. I'll draw another picture of it later on, which will be better. Okay, but there's the tympanic membrane demarcating the edge of the external auditory canal, and then this here, this is the middle ear cavity. Okay, and the middle ear cavity has this connection with the pharynx through the eustachian tube. So the eustachian tube will come out of the petrous portion of the temporal bone and then will go forwards and join with the pharynx in front. So we're no longer in the calvaria, we're going into the viscerocranial portion of the skull. So remember, the calvaria is the portion that actually contains the brain. I'll write some of these keywords down. So the calvaria is the portion of the skull that actually contains the brain. The viscerocranium is the portion that actually makes up the face. So this tube is not going into the inside of the calvaria, it's going down to where the viscerocranium is, and it will join onto the pharynx at the nasopharynx region. So if I just draw a little picture of this over here, if this is the nose, here is the lips, and here is the chin. Okay, so we'll have the oral cavity here, and then we'll have the nasal cavity here, like so, and the nasal cavity will go into the nasopharynx. The oral cavity will then join up with the pharynx, and this portion is known as the oropharynx, and then it will go down to the laryngopharynx down here. The eustachian tubes on both sides will join up at the nasopharynx region, like here. So this is the right eustachian tube, and this is the left eustachian tube here. Okay, so those are the eustachian tubes, and what those allow you to do is make sure that the pressure of air inside the middle ear cavity is the same as the pressure of air inside the external auditory canal. You see, the external auditory canal, the pressure in here is going to be the same as normal air pressure. And of course, by the way, we're at the moment talking about before we've actually got any sound. I know sound is a propagating disturbance in pressure. We'll talk about that at the moment. But let's say it's completely quiet at the moment and the pressure isn't oscillating at all, then the pressure inside the external auditory canal is going to be the same as in the environment. We don't want the middle ear cavity to be completely sealed off, because then there's a risk that the pressure inside here might differ from the pressure here, which will create a transmembranous pressure difference across the tympanic membrane and would potentially lead to the tympanic membrane bursting because of that pressure difference. So the eustachian tube allows a connection between the middle ear cavity and the rest of the world, so that you can equalize the pressure in the middle ear to the pressure in the external auditory canal. That's the idea of it. Okay, so that's the connection between the middle ear cavity and then the rest of the world, then the eustachian tube. Okay, and I'll just try and straighten this up a little bit more. Right, so now what we want to go on to is the inner ear, which is also known as the labyrinth. Now this is the most complicated portion to draw. So, as I've already said, I will come back to what's inside the middle ear. There is three very important little bones inside here. We'll talk about those later on. For now, what I want to do is concentrate on getting the labyrinth communicated across. I want to teach you about the labyrinth first, and then we'll come back to talk about the ossicles later on, because it's easier to motivate what the ossicles are going to do once we've discussed a little bit about the labyrinth. Okay, so this picture is going to be a little bit small, which is going to be difficult to draw this on, so I'm going to draw probably multiple pictures of the labyrinth. One initially on here, which will be small, and I'll draw a much bigger one down here. Okay, so here it comes. This is the portion that looks like a seashell with not the semicircular canals coming off. So here we go. So it's probably best actually, how should I start? I'll start here. I want to make sure I get the right number of turns. So the general quoted number of turns of the seashell that you have in the labyrinth is 2.5. So I'll start in the center here, like so. And then we've got one turn there, and then we'll have so this is one complete turn here. We'll have another second complete turn here, and then we've got another half turn there. So like that, and it's a little bit big because I don't really now have room to actually put the semicircular canals in, but I'll have a go anyway. So we will then have one semicircular canal there, which is supposed to be representing the lateral one. We'll have another here, which is supposed to be representing the anterior one, and then we'll have another one here, which is supposed to be representing the posterior one. Okay, and I will draw that out again, but for now, there is my first picture of the labyrinth. So just to tell you about the different portions here. So the labyrinth is the name for all of this structure, and it's inside the petrous portion of the temporal bone. Everything that I'm drawing here is inside the petrous portion of the temporal bone. This is all inside of this bone here. So this is still inside here. It's around the area where the internal auditory meatus is. So if you follow the internal auditory meatus in, you'll find this portion. You'd be coming in behind it, so the internal auditory meatus will be behind it, because this is all viewed from the front. I should have actually said that. We're looking at the right hand side, we are looking from the front here. Okay, and the labyrinth for the inner ear is the name for absolutely everything here. So it's the name for this portion here, and the name for these semicircular canals here. The other important thing to say is that it's the name for the bony portion on the outside, and then all of the stuff inside as well. It's the name for the entire area. All of this is the labyrinth. It's not just the name for the bony portion. We're going to firstly study the bony portion of the labyrinth, and then we'll come to what's actually inside the bony portion. But the bony portion is known as the bony labyrinth. So we're now going to start studying the bony labyrinth, which is the outside of the labyrinth. So the outer portion of the shell is made up of bone. Okay, and that's the portion that we're going to study first, the bony labyrinth. Now, before I forget, let me just give you a little bit of background information. So if you get inflammation in the external ear canal, that's known as otitis externa, so a little clinical correlate here. So when you get an external ear inflammation, potentially because of infection, that's known as otitis externa. It's common in people who are putting things in their ears regularly. So people with hearing aids, for instance, they get a lot of otitis externa because it predisposes you to infections in that region, and then you'll get inflammation. Okay, it's not particularly painful, but it's reasonably irritating. Otitis media is the name for inflammation in the middle ear cavity. That's much more severe, much more painful. So this is otitis media. Okay. Finally, inflammation in the inner ear, or the labyrinth, you can call it otitis interna if you like. However, it's far more common to see it referred to as labyrinthitis. So if you get inflammation potentially because of an infection in the inner ear, you refer to that as labyrinthitis. Okay. Now, few more background pieces of information. This portion here, okay, down from about there, that of the labyrinth, that is what is known as the cochlea. And that's the portion that is actually going to be involved in hearing. The portion of the labyrinth up from that, there's a portion known as the vestibule, and then above that you've got the semicircular canals. They are involved in the vestibular system. They're involved in balance. Okay. Now the cochlea is the portion we're going to be studying, but just so that we've got the entire picture, we will initially study the, just so that we understand the anatomy completely, we will initially study the vestibular portions of the labyrinth as well. Okay, another little fun fact about the cochlea is that it's roughly about the size of a pea, so that puts it in perspective. So it's roughly about this sort of size, like so, the size of that circle that I've drawn there. Right, so the next thing I want to do is draw this more precisely. I want to draw the labyrinth better than I've drawn it previously, and I want to show you the bony portions first. We will come on to discuss the portions inside, and again I'm going to study all of the labyrinth at the moment rather than just the cochlea portion, just so that we've got a complete understanding of the anatomy. Okay, so I'll draw it now larger down here, and I want to make sure that I will actually have room to put everything this time. Okay, so we'll start like so. So here's the innermost turn here. So that's my first turn. I've gone round from here to here. That's one turn. And then we'll come round again. So here, there's another turn. So from here to here, that's the second turn. And then we go round from here to here, that's a half turn. So that's why I say there are 2.5 turns. Some people say it's 2 3/4 turns. 2.5 is the more common number to see it referred to as. Okay, then after the cochlea, that's the cochlea complete there. So this is where the cochlea ends. But after that, you've got a portion that is known as the vestibule, and this is part of the vestibular system. So this is known as the vestibule, and off the vestibule are going to come the semicircular canals. Now you have 3 of these, and lateral one, which I'm going to draw on first. Okay, and these have swellings that are known as ampullae, singular ampulla, at certain junctions between them and the vestibule. So this semicircular canal that I've shown there, that is the lateral semicircular canal, and hopefully it's reasonably obvious why they are known as semicircular canals. I will stress again that we are at the moment talking about the bony labyrinth, so this is the bone portion of the labyrinth that is sitting inside the petrous portion of the temporal bone. We've got the bony portion of the cochlea here, so I'll call that the bony cochlea here. We've then got the vestibule, which is a bony portion of the labyrinth that is part of the vestibular system, and now we've got the semicircular canals, which are the name for the bony portion. Inside them they will have a membranous portion known as the semicircular ducts, which we'll talk about later on. Okay, so bony, cochlea, vestibular. So we've so far got the lateral semicircular canal. Next, what I'm going to put on is the anterior semicircular canal. So again, here is an ampulla. I'll put that keyword down here. So an ampulla is this swelling at the bottom of the semicircular canals. And then here is the anterior one going backwards like so. And then off it, it will have a posterior one coming like this and connecting on down here maybe. Like so, and it's behind the lateral one. Right, so if I try and... So those two, the anterior and the lateral, the anterior and the posterior, they have a common sort of bit that they come off here. Like so. Okay, so that, I think, is the best picture I'm going to be able to draw of this. So this one here, that is going sort of directly up, it's sort of in the sagittal plane, if you like. This is what's known as the anterior semicircular canal. I'll just write anterior. So I'll colour it in orange here. So this is the anterior one here. And the anterior and the posterior semicircular canal, they share this portion in common. So they have a common part that enters back into the vestibule, that joins back onto the vestibule. So here, this is the posterior semicircular canal, and it's kind of in the coronal plane. This one's in the sagittal plane, that one's then in the coronal plane. And as you can see back there, there's that portion that is common to the anterior and posterior semicircular canals, which joins back onto the vestibule there. So that's the posterior semicircular canal, and I'll colour that in pink. And then on the side, we've then got the lateral semicircular canal, which I'll colour in blue. And this kind of is in a plane between the sagittal plane and the transverse plane. So it's not quite in the transverse plane. Some people quote it as being in the transverse plane. The reason that they do that is they like to say that you have one semicircular canal in each of the planes. The anterior one's in the sagittal plane, the posterior one's in the coronal plane, and the lateral one's in the transverse plane. However, it's not quite that beautiful. Instead, the lateral semicircular canal is kind of at an angle between the transverse plane and the sagittal plane, like so. Okay, so that's the lateral semicircular canal there, coming off the vestibule as well. So this is the bony labyrinth then, consisting of the bony cochlea, the bony vestibule, and the semicircular canals. And this is the bone that is going to contain lots of other structures that we're going to discuss in the next video. I'll stress again that all of this is inside the petrous portion of the temporal bone, so this will all be surrounded by bone. If I colour this in, it will be surrounded by more bone. Okay, so we'll have a break here. In the next video, what we'll do is we'll study the bony cochlea in more detail. We'll see that the bony cochlea is made up of the spiral canal and the modulus. And then we'll have a look at the actual things that are inside of this, because all of this is hollow. The semicircular canals, the vestibule, and the bony cochlea here, they're all hollow, and there's a space inside that lots of things are going to be sitting in, and we need to understand that in a lot of detail. So we'll have a break here and we'll continue on our discussion in the next video.